You are obviously aware of the rising costs of health insurance. Each year, your premium goes up, and so does your deductible. Many times, because you are using an HMO network, your doctor won't even accept your insurance card. You and your family are relatively healthy and need a health plan mainly for catastrophic events. Spending hundreds of dollars each month on premiums and then having to pay out-of-pocket expenses like your deductible is just absurd. So, what are you to do? Well, here's an idea. How about a plan designed for healthy families and catastrophic events? This plan could save you hundreds of dollars each year on premiums. So, what does the plan include? Low or no deductibles? Price points designed to fit your budget. Access to a PPO network. Pays out-of-network expenses. Includes doctor's office visits with a preventative care benefit. Co-pays for generic and brand name pharmaceuticals. Covers catastrophic events such as cancer, heart attack and stroke. Is guaranteed issued if at least 2 family members obtain the plan. Includes a concierge service that navigates you to a physician or specialist near your zip code, and uses Teladoc, a convenient alternative to urgent care or ER visits. Teladoc allows you to communicate an illness to a doctor over the phone or computer. Now you won't even have to leave home for a doctor's visit. Well, here's some good news. Philadelphia American Life Insurance Company, or PORLIC for short, has created a plan with all of these features. PORLIC has designed a health and income protection plan. With this health plan, costs are less because its benefits have been adjusted to fit your needs. This health plan is structured differently. Each policy has $5 million of total protection. Depending on which plan option you choose, there are either low or no deductibles and copays. Instead, this plan pays a defined amount for covered services. Maternity is not a covered expense, and pre-existing conditions are covered only after 12 months of continuous coverage on the policy. Therefore, if you need ongoing medical attention or can qualify for a government subsidy, you're encouraged to enroll in a marketplace health plan from your broker. Now let's review the structure of this policy and how it works. This policy is divided into 3 categories. First, a facility or hospital benefit. Second, a surgeon's or professional services benefit. And finally, an outpatient care benefit, better known as doctor's office visits. To deliver a plan that suits your budget, each package follows these simple steps. First, you choose an annual maximum benefit payout. This is the maximum amount of money the plan will pay in a calendar year. Then, you choose a daily dollar value for each grouping, known as a unit. Units are defined bundles of money in a column or group of benefits used as payments to hospitals and doctors. Finally, you choose from one of 5 deductibles. You can even decide you don't want a deductible. However, the most common deductible is $2,500. Now, let's determine how the daily dollar benefit values for a facility or hospital are calculated. The plan has a defined amount it pays to a facility, hospital or ambulatory surgical centre, which is separate from defined benefits for surgeons. This plan pays a daily set benefit amount for hospital and intensive care confinement. It combines the hospital confinement benefit with mental illness, alcohol and the substance abuse benefit. It also combines the hospital confinement benefit with rehabilitation and skilled nursing benefits to give you maximum protection. In addition, PORLIC has added a daily benefit for radiation and chemotherapy treatment. This benefit is enhanced tremendously when combined with the critical illness policy. Consult your brochure for details. According to the Agency for Healthcare Research and Quality, at least 61% of all surgeries are done on an outpatient basis, so we have an added bonus. For surgeries performed on an outpatient basis or ambulatory surgical centre, the deductible will be waived for the first claim incurred in a calendar year for each covered person when the surgery is performed under general anaesthesia. General anaesthesia only means you are placed to sleep during the procedure. All benefits for a facility or hospital service range from $1,500 to $6,750 per day, depending on the number of units selected. Consult your brochure for details. The next category is professional services. This benefit pays the surgeon, pathologist, radiologist, assistant surgeon and anesthesiologist. The plan will pay professional fees according to the Medicare Physician's Fee Schedule for surgeries. This is a set dollar amount used as a reference by Medicare to determine the cost of medical procedures performed by surgeons. Units, as it pertains to professional services, is a multiple of the Medicare physician's fee schedule. Therefore, if you have 3 units, the surgeon can receive 3 times the Medicare physician's fee schedule for a medical procedure. Commonly, and with this product, the assistant surgeon receives 20%, with the anesthesiologist receiving 25% of the surgeon's fee. These are all daily benefits. Our third category, outpatient benefits, also known as doctor's office visits, includes MRIs, CAT scans, diagnostic testing, lab testing, prescription drugs, emergency room, urgent care, preventative care, and emergency ambulance services. These benefits are all accompanied by a separate $50 deductible. However, for a sick doctor's office visit, the deductible is waived for the first 3 visits to the doctor and is applied to the 4th visit. The preventative care benefit is initiated 60 days after the effective date. To see how much your plan pays, consult the fee schedule on your brochure. Now, to package this plan and make it competitive to a major medical policy, Porlick included several additions such as a PPO network, an enhanced accident plan, a critical illness plan, a pharmaceutical card, Caris 360 and Teladoc. Now let's examine each of these in detail to determine their value. The PHCS PPO network is one of the oldest and largest healthcare networks in the country. This network reduces costs by repricing procedures, doctor's visits and facility use. This works by reducing medical costs to near or below what the plan will pay and can result in little or no out-of-pocket costs to the end user. In many instances, with the in-network charge low and the plan payment higher, policyholders could walk out of a medical procedure with money in hand. In other words, with an overpayment from this plan, the policyholder gets the difference. However, from an underpayment from the plan, the policyholder pays the difference. This is the importance of using in-network doctors. You are reminded that the policy will pay in and out of network charges, but it is the smartest to reduce costs first by staying in-network before undergoing a procedure. In-network doctors can be searched online before signing up for a policy. Caris 360 can help in setting up a doctor's office visit or hospital procedure for you, as you will see later. Once at the doctor's office or medical facility, benefits are usually coordinated without a claim form. The enhanced 24-hour accident plan works side by side with the hospital benefit plan. When an injury is incurred, such as a burn, broken bone or cut from an accident, this plan pays, in addition to the hospital-defined benefit plan, up to $4,000 per incident. The enhanced accident plan reinforces the outpatient section of the hospital indemnity plan by giving additional protection from costs related to X-rays, MRIs, CAT scans and other diagnostic testing due to an injury. It also provides up to $300 a day of income protection, a $10,000 benefit for ground and air ambulance services and a death benefit of up to $100,000 to the primary insured. To give you peace of mind, Porlick has included a critical illness policy designed to give a financial cushion by replacing income in the case of a catastrophic event such as a heart attack, stroke or cancer, along with 8 other critical illnesses. This has a maximum cash benefit of $50,000 to be used to pay non-medical expenses resulting from a covered condition. Once diagnosed, the payout can be used to pay experimental treatments that are not covered by or limited to existing medical insurance. It can also be used for whatever is required at the time, such as a mortgage payment, auto loans and credit card payments. It can even be used to take a vacation that may be well deserved. Caris 360 is a concierge service designed to be your personal advocate. Their services are designed to assist you during each stage of your healthcare experience. This includes unlimited access to a dedicated team of professional advisors available by phone to assist with healthcare-related questions. Caris has expert advisors to help you find the right doctor, healthcare facility and obtain the best available pricing for procedures and lab tests. Caris will shop local and regional markets for healthcare facility options, which include surgeons and specialists. Also, if your out-of-pocket expenditures are unexpectedly high, Caris will negotiate your medical bills to reduce these costs. Next, Porlick teamed up with Pram, a fully insured pharmaceutical drug card offering $400 a month of benefit to an individual and $800 a month to a family. This card has copays for generic as well as brand name drugs. When the Pram drug card is combined with the prescription drug indemnity benefit, your out-of-pocket expense is reduced and in some instances eliminated. This card gives great savings if you use prescriptions on a monthly basis. ScriptSave is an online discount prescription drug program. By using this benefit combined with Pram, you will know the lowest cost and closest location of a prescribed drug near you before purchasing. Finally, for those minor illnesses or common children's sicknesses, there's Teladoc. Teladoc is a convenient alternative to urgent care or ER visits. Teladoc has US board certified physicians who are available 24/7. Teladoc allows you to be diagnosed and order prescription drugs from the convenience of your home, thereby saving you the time and cost of a doctor's office visit. This is extremely convenient when dealing with children's illnesses and common colds or the flu. If you have questions or need further information on how this plan works for you, consult your broker or call the number below.